So when the pandemic first began, immediately the city and the county and others began working together to move people out of congregate shelters, particularly those who were at high risk of severe medical complication associated with COVID 19 or people who had contracted COVID 19 and putting them into hotel rooms and other locations to reduce the number of people staying in any one congregate facility. And so at that time, there were about 770 emergency shelter beds for people experiencing homelessness throughout Pima County. And rapidly, the traditional shelter capacity decreased to about 25% of that over the course of 2 weeks. And we were able first to launch about 300 additional shelter spaces in hotels, which ran for several months. Um, and then at, at the end of that hotel period, there's been an opportunity where congregate shelters have been able to begin to increase their capacity, but not to the same level that it was before the pandemic.
And of course, we've reported in the past about how the city of Tucson has taken millions of dollars from the federal government and used some of that money to buy buildings to provide housing for people who are in homeless situations. Yet we continue to see the camps, the encampments all around town. What is happening out there?
So we do believe that there has been some increase in unsheltered homelessness, so people sleeping outside over the last year. And we expect that's probably an increase somewhere between 150 and 200 people based on the best data estimates that we have. Unsheltered people are notoriously hard to count. So where we know that there is some increase, we actually know that what we're seeing right now of more visibility of unsheltered people is actually a community awakening to the crisis of homelessness in Tucson. So these are folks who historically have stayed further out in washes, further in desert areas, much more afraid of detection. And so during the pandemic, protocol, so law enforcement activity that moved people that were staying, that were sleeping in places not meant for human habitation along into other areas. Those activities were ended, right? So they were paused throughout the pandemic to prevent, the spread of the virus, risk to people who are unsheltered, as well as the people contacting them. And so then what we've seen are more homeless people being visible in our community. And so what we're seeing right now is a crisis of visibility. And it's a moment for all of us, I think, as Tucsonans to really band together to work to end homelessness. These are our community members, and they've always been here. We're seeing them more regularly now.
You mentioned visibility. The county and the city have been working on, quote, reducing that visibility, but that's obviously not a solution to the long-term problem, is it?
Absolutely. So reducing the visibility doesn't change homelessness, right? And the real tragedy here is homelessness. And so the city and the county and others, I always want to acknowledge the incredible work that nonprofit partners are doing throughout the community, are working to reduce homelessness. And we've seen gains in those areas. So while the overall numbers are increasing, we're seeing, particularly among people who are chronically homeless, for example. So chronically homeless people are the folks who are sort of the most hard to serve. They're the people that someone generally thinks of when they try to envision what homelessness looks like. Someone maybe who has complicated mental health history, things like that. Um, Chronically homeless people, about a year ago, there was a 6-month period where we did a study of our rates of housing those really hard to serve homeless folks. And we saw that we were housing about 6 of those people a month. So while the homeless response system was providing lots of housing, it wasn't reaching the folks who had that most critical need, who are the people you see sleeping outside beside I-10 or in a park. And we looked at the same 6-month period this year and had made a number of changes in our system and how we prioritize people for housing over the last year. So when we looked at that same 6-month period this year, we saw that we were housing about 23 people on average a month from that really high risk pool, which is an increase of about 280% in terms of our rates of housing those folks who are the most at risk and those who have the greatest risk of complication and really fatality on the streets. So currently, the federal government, through a recent allocation, has now released home investment partnership funds through the American Rescue Plan. And our community is receiving about $12.7 million in that funding, which is really geared more at that long-term housing stability, supportive services, those key elements you're talking about, and really building up the housing capacity. So increasing stock through development or acquisition of properties. So we see in early pandemic, this response that was really short-term focused, and now pivoting with federal funds to a more longer-term solution that really looks at how to build the housing capacity in the community to support low-income and homeless people.
All right, Jason Thorpe from the City of Tucson Housing and Development Department, thank you very much for joining us.
Thanks so much for having me.